Paul Jones and his wife Jan had lived comfortable lives in Eugene, Oregon for nearly 20 years. He as a successful neurologist, she as a registered nurse. They enjoyed trendy cafes, live theater, and Eugene's eclectic mix of art, music, and the outdoors. Then they went rogue. In 1989, they sold their house and began a 20-year personal and spiritual exploration, joining various Christian missionary agencies in some of the most volatile places on earth, including Somalia and Rwanda.
I was only 55. I felt I was still young enough to go overseas and withstand any rigors we might face.
Rigors indeed. They lived in tents, bamboo huts, and simple houses, teaching and training generations of healthcare workers, treating horrendous wounds from machetes and landmines, and helping to build hospitals and clinics. Several times they were hastily evacuated by the United Nations as civil wars closed in around them. Once they were held captive by rebels.
Well, we certainly didn't know what we were getting into, that's true. It's just a progression of events that occurred that made us want to be missionaries.
Jones' middle-class parents raised their family as active churchgoers in Portland, Oregon, and Jones had become interested in missionary medicine at the precocious age of 11.
I had read a book when I was a child which was called Shelton in Tibet, and it was about Dr. Albert Shelton, who was a missionary to Tibet. His book was an inspiration, plus the fact that my brother also became a doctor and a missionary.
He came to Duke for medical school in 1961, specializing in neurology and citing J. Lawton Smith as a great influence, as well as the compassion his professors showed to patients. With missionary medicine in the back of his mind, he took a spirited interest in tropical medicine and a book written by Duke doctors David T. Smith and Norman F. Conant.
I just think the exotic illnesses, the guinea worm and many of these illnesses were very interesting. The things that I felt helped the most there was just persistence, curiosity, and tendency to want to make others better. Duke was great, and I really loved it there.
He settled into a comfortable neurology practice in Eugene, but after 18 years, it was time to put his faith to work in a big way. Their first assignment was at a Cambodian refugee camp in Thailand, where they spent 4 years treating refugees fleeing the Khmer Rouge.
There were 40,000 refugees there, and 4 doctors could not take care of that many people.
They joined relief efforts in volatile Mogadishu, Somalia in 1993 during the height of the country's civil war. After just 3 weeks in Somalia, they were feverishly evacuated by the UN.
It was a very sinister place, really a horrible place to work.
They spent 9 months in Sudan and found themselves pinned down in a bunker during a day-long gunfight between warring factions. They were taken captive by a rebel group and held for 19 hours.
I don't think we really feared for our lives, and I don't know why.
Then, in 1994, genocide erupted in Rwanda when the Hutus began slaughtering Tutsis. The Joneses were assigned to a refugee camp overlooking the capital of Kigali.
So we could actually see the fighting below us, but we were mainly treating patients at that time that were wounded and were brought up to us. The machete wounds are not fun to watch, and certainly not landmine injuries.
They remained in Rwanda for 4 years, treating patients, training healthcare workers, and helping to rebuild hospitals. Much of their later life missionary work was back in Thailand, where Jones helped to establish a barefoot doctors program that trained community health workers from Thailand and Myanmar to provide care in remote areas where there was none. Their long-term efforts in Thailand earned them a great distinction in 2009, when a new teaching building in Chiang Mai, Thailand was dedicated in their honor.
And I think this is a great feeling of satisfaction that we know that medical work is increasing in that area. Many lives have been saved.
The Joneses resettled in Eugene and have been married for 57 years. They have 4 surviving children and 13 grandchildren. Reflecting on the global impact that he and Jan have had in their missionary work, he is quick to deflect any personal credit.
My Christian faith is the driving force for our missionary work, absolutely. But I think the main reward is just to know that we have done a good job and the Lord is with us.